apparatus check. This is a very important point that you, all of you, I think it is a training that is missing because nowadays we have OT technicians employed in all the theaters. So we depend on them and we believe that they would have done the proper check of the machine and straight away we go and start the cases. But during our postgraduate days, we were compulsorily made to do the regular machine check ourselves because there were not many OT technicians or trained people like this. So the now the youngsters, you are all depending on the OT technician for checking the machine. But my sincere advice will be better you learn how to do the checking and you also make at least the first initial case when you start, you make a routine check on yours by yourself and make sure that the OT technician has done the correct way of checking the machine and don't blindly believe them. My way of doing anesthesia is I always doubt my own self. In that way, I try to be as safe as possible. So any drug that is loaded, I always ask for the ampule. I check the expiry date and then see whether the drug has been properly loaded. So don't blindly believe the technicians and always cross-check and verify so that the patient safety is always maintained. Okay, yes, go ahead.
So these are the recommendations given by American Society of Anesthesiologists in 2008 to be completed daily or after a machine is moved or after any addition or alterations made to the machine. So they are given 15 items in the order. Item 1 is to verify the auxiliary O2 cylinder or a manual ventilation device, which is the ambu bag, are available and also functioning. Item 2 is verify patient suction is adequate to clear the airway. Item 3 is to turn on the anesthesia delivery system, that is to turn on the master switch and confirm that the AC power is available. Item 4, verify availability of required monitors. All are working and the limits are set and the alarms are working. Item 5, verify that the pressure is adequate on the spare O2 cylinder mounted on the anesthesia machine. Item 6, verify that the piped gas pressure are more than or equal to 50 psi or more than 400 kilopascals. Item 7 is to verify that the vaporizers are adequately filled and if applicable, the filler ports are tightly closed. Item 8 is to verify that there are no leaks in the gas supply line between the flow meter and the common gas outlet. Item 9 is to test the scavenging system function. Item 10 is to calibrate and verify the calibration of O2 monitor and to check the low O2 alarm. Item 11 is to verify CO2 absorbent is fresh and not exhausted. Item 12 is to perform breathing system pressure test and leak test. Item 13 is to verify the gas flows properly through the breathing circuit during inspiration and exhalation and working of the inspiratory and the expiratory valve. Item 14 is to document the completion of checkout procedure. Item 15 is to confirm the ventilator limits and the readiness to deliver anesthesia care to the patient before starting each case. Some of the recommendations to be completed prior to each procedure are verify patient suction, availability of required monitors and alarms, verify the vaporizer is adequately filled before doing the case, and verify the CO2 absorbent is fresher and not exhausted, perform breathing system pressure and leak test, verify the gas flows properly through the breathing circuit, document the checkout procedure and confirm the ventilator settings before starting the case. These are the recommendations to be made, and the protocol for checking the anesthesia equipment are some modern anesthesia machines have self-check test, and also the recommendations to check the machines are to check the alternative means of ventilation, self-inflating bag and the alternating source of O2, and the suction is working, all the connections are secure and it has adequate negative pressure. Power supply, whether the anesthesia workstation and the relevant equipments are connected to the main electrical supply, and there should not be multi-socket extensions when the anesthesia workstation is connected. Backup generators and backup batteries should be ready and charged. All the monitors are working. Appropriate parameters and alarms to be set before, including the sampling and the frequency of non-invasive blood pressure. Gas sampling line should be properly attached and it should be free from obstruction or kink. And if the sampling port is not in use, it should be blocked. The low O2 failure alarm can be checked by disconnecting the O2 pipeline on some machines, but it leads to premature failure of Schrader sockets. It is done weekly once, and the tuck test is performed in the daily basis instead of disconnection. So O2 failure alarm, the sound should be played at least for 7 seconds, and the anesthetist should be aware of the tone of the alarm. Check all the pipelines, confirm with the tuck test, and look at the pressure gauges should be shown 400 to 500 kilopascals. Check adequate O2 supply is available in the spare cylinder. Operate the emergency O2 bypass control and ensure the flow occurs gas outlet. And also check the O2 bypass control ceases to operate when it is released. Vaporizers, we have to check whether the vaporizers are fitted correctly, any locking mechanism is fully engaged, the control knobs are able to rotate fully throughout the range without any obstruction. Ensure that it is fully filled but not overfilled, and it should not be tilted. Turn off the vaporizers after checking it. And some manufacturers recommend manual leak test for vaporizers. Flow meters, we should check the operation of the flow meter. We should ensure the control valve opens fully, and anti-hypoxia devices should be tested by first switching on the nitrous flow, and we have to check at least 25% O2 is flowing. And also we have to cut the O2 first, and we have to look whether the nitrous is also shut off. Turn on the O2 flow and check for 100% O2 in the O2 analyzer. Scavenging system, we have to check this scavenging system is switched on, it is functioning, and the tubings are attached, and there is no obstruction or kink in the scavenging system. CO2 absorbent, look for the date of the change of absorbent, look for the color of the absorbent, and check for the content and connections. Breathing system, we have to check all the connections within the breathing system, which includes cath mount, filter, all the circuits, connections, and also to the anesthesia machine by push and twist. We have to perform 2 back test or pressure leak test to check the integrity of the breathing system. And in the ventilator, we have to ensure the tubings are secured and the alarms are working and the settings are ready to use for the patient. And finally, we have to check for the alternate breathing system. For Baines type of system, we have to check it by occlusion test on the inner tube. And we have to check the integrity of both inner and the outer tube by visually, and also by doing the Pethiks and Fix-Crompton-Smith test. We have to check for the APL valve, whether it is fitted and it is fully opened or closed. Finally, airway equipment. It includes all the bacterial filters, catheter mount, connector, tracheal, laryngeal mask airway, laryngoscopes, airways, and everything. So we have to check that are available in appropriate sizes and should be checked for patency. Bacterial filter and angle piece catheter mount are only for single use and changed for each patient. Circuits are checked for patency, both visually and when connected to the breathing system. Appropriate laryngoscopes and blades are available and functioning. Difficult airway cart must be available, checked regularly, and the location should be known. Thank you, sir.
Very good. A very correct, exhaustive preparation for this. Only suggestion I can give you is you can divide the checklist into the high pressure system, the intermediary system, and the low pressure system. That way you won't forget each and every point, right? Starting from the central pipeline to the attachment to the machine, and the presence of a spare cylinder is very, very important. And alternate measures of ventilation like ambu bag should be present in all theaters. And from the high pressure to intermediate, from the flow meter to the common gas outlet, and then the breathing circuits. In that way, you won't forget anything. And that was a very nice presentation. Anyway, just for